Malaysia's national budget has played a crucial role in driving the country's economic growth.
The budget main focuses here are on the country infrastructure development, economic growth, fiscals, and the social supports primarily for the low-income groups. The government's approach focuses on the long-term effects of the fiscal consolidation and investments key such as healthcare, education, tourism, taxation, and also securities. However, the outbreak of COVID-19 pandemics during 2020 creates a significant challenges in the country that causes a large-scale change in the budget allocation to fix the economic fallout by focuses more on the healthcare systems and provide an incentive for the business owners and individuals who are affected during the pandemic.
In the years leading up to the COVID-19 pandemic, Malaysia's national spending reflected a period of adjustment and cautious optimism, with budget 2018 amounting to RM 290.4 billion and rising to RM 314.5 billion in budget 2019 as the country aimed to stimulate growth while strengthening fiscal responsibility. GDP grew from 4.8% in 2018 to 4.9% in 2019, supported by an increase in operating expenditure from RM 235.45 billion to RM 259.85 billion, and steady development expenditure rising slightly, from RM 48 billion to RM 56.7 billion. Major infrastructure plans such as the Pan-Borneo Highway were maintained, subject to cost rationalization, and direct or limited tender contracts worth RM 19 billion were renegotiated with a targeted minimum 10% cost reduction to improve efficiency. Fiscal deficit narrowed from 3.7% in 2018 to 3.4% in 2019. To support businesses,
corporate tax for SMEs earning up to RM 500,000.
With paid-up capital under RM 2.5 million was reduced from 18% to 17%, while companies helping employees settle PTPTN loans were granted tax relief, alongside RM 100 million channeled to TIKAN to support small entrepreneurs. Property policies were tightened with higher real property gains tax, while the minimum wage was raised to RM 100 nationwide starting January 1, 2019. Fuel subsidies were restructured, offering RON 95 subsidies for one car below 1,500 cubic centimeters or a motorcycle below 125 cubic centimeters, and toll exemptions for motorcyclists took effect at the Johor Second Link and both Penang bridges beginning January 1, 2019. The government introduced property crowdfunding initiatives for first home buyers, adjusted stamp duty for properties above RM 1 million to 4%, and allocated a RM 40 monthly electricity subsidy for EKC households, while a new departure levy imposed RM 20 for outbound travelers to ASEAN countries and RM 40 for other international destinations. These measures collectively reflected Malaysia's efforts to balance welfare, development, and fiscal sustainability in the pre-COVID landscape.
Next, Malaysia budget during current COVID. Firstly, in 2021 due to peak of COVID-19 pandemic, the Malaysia's budget rise to RM 322,540 million, where 5.3% of the budget goes for COVID-19 fund including for implementation of the movement control and public health service needs like personal protective equipment, PPE, reagents and consumables for Ministry of Health Malaysia. Secondly, the COVID-19 pandemic causes the Malaysia's budget in 2022 to increase higher than 2021 budget, where the budget allocation is RM 332,100 million. Due to COVID-19 cases increased to 4.6 million, the fund for COVID-19 increased to 6.9% from the budget for vaccination programs, enhancing the capacity of public health services such as procurement of medicines, medical consumables and increasing facilities capacity like hospital and ICU beds.
Now we look at post-COVID-19. In 2023, Malaysia was still in the early phase of post-COVID recovery. The total expenditure is RM 386.140 million. The government prioritized healthcare and education, which were heavily affected during the pandemic. Healthcare received RM 36.3 billion, while education received Rm 55.2 billion, remaining the largest allocation. These allocations were important for repairing damaged school facilities, improving digital learning access, and strengthening hospital capacity. Economically, Malaysia still felt global pressure. Inflation in 2023 averaged around 2.5%, affected by food prices and global supply disruptions. In 2024, Malaysia entered a stronger growth phase that GDP expanded by 5.1%, higher than many regional economies. Inflation dropped to 1.8%, showing good price stability despite global uncertainties. Government spending again prioritized people-focused sectors. Education increased to Rm 58.7 billion and healthcare increased to Rm 41.2 billion. In 2025, the government expenditure is Rm 421 million. In 2025, Malaysia continued strengthening its recovery, with more focus on reforms. GDP in the first half of 2025 grew around 4.4%, supported by strong domestic activity. Inflation remained low at 1.1% in June 2025. Unemployment improved further to about 3%, showing a healthy labor market. Budget 2025 introduced major structural reforms, including TVET expansion for future-ready skills, digitalization for SMEs, continued strengthening of hospitals and public clinics. Malaysia also continued subsidy rationalization to reduce pressure on national debt.